Alright, so I'm going to be talking about traction for cervical joint hypomobility, specifically for the C6 and C7 joints. And again, this is to relieve some of that hypomobility, and that's definitely one of the indications for traction. Before we start, we're always going to assess cognition to make sure that the patient is able to tell us if something doesn't feel right, if it's painful, or if it's uncomfortable. In addition to, looking at the skin still, even though, it's not like typical modalities, you're still putting the traction on the head, and we don't want to put the traction over any area that has broken skin. So some contraindications for cervical traction. If there's any kind of spinal fusion or fracture, we don't want to have motion there, so that would be contraindicated. Any kind of acute injury or inflammation, because some of that stretching might aggravate the tissues. And specifically, a precaution for hypomobile joints is that if there's hypomobility in one joint, there could be hypermobility in another joint, so that's something to watch out for. In addition, uncontrolled hypertension, traction can increase hypertension, so that is a contraindication. So other precautions to keep in mind, especially since we're doing cervical traction, is dentures. We just keep them in during treatment. If you take them out, that can alter the position of the TMJ. So as we're moving into actually applying the cervical traction, we're going to think about a few things here. In terms of patient positioning, we're going to go ahead and have the patient in supine so that we can get some slight flexion, and that will help target some of the lower cervical vertebrae. The type is going to be intermittent. The hold relax time is going to be 1-to-1, so 15 seconds on, 15 seconds off, and this is again to target the joint dysfunction. The force is going to be lower because, again, we're looking at the neck, so it's going to be 7% of the body weight, and a lot of times you can start around 8 pounds and then increase 3 to 5 pounds per session. So, and then as we increase, we don't ever want to go beyond 30 pounds typically. So time, we'll go ahead and start with 5 minutes, and we'll go ahead and do this for 2 to 3 times per week, and continue to assess how the traction is alleviating this patient's symptoms. So other interventions that could help kind of with the same goal of the joint hypomobility could be manual stretching of some of the soft tissue structures in the neck, especially those muscles, in addition to joint mobilizations of the neck, which we have not learned yet. But so that concludes the video.